Hi, Rich. Okay, our last question. Medical devices and implant registration. We all know that it's now front page news. Can you tell me more about if there's research or studies happening in this area that you can share with the audience?
Well, what I would tell you is that there is a medical device industry in Canada called MEDEC, and they represent a large number of the medical device companies in Canada. And I think that they would be a wonderful organization to speak with. I know that they're both concerned about the well-being of the industry, but also very concerned about the well-being of the populace. And I'm sure that they are working right now on some policy directives around this.
Great. For sure, we're going to be talking with them. And can you name an initiative or talk about a project that might be going on that is sort of in this milieu?
Sure. So this is a big challenge for us when we think of medical devices and how medical devices can impact us going forward. Let me give you an example that's emerging right now in Alberta. There is a small local company that's working with artificial intelligence technology around ultrasounds. And what this is enabling individuals to do is to have ultrasounds in the field. Biggest challenge right now is most individuals have to come into a care center to have ultrasounds done. Ultrasounds can be very good in terms of detecting and then allowing preventative actions so that we don't hit into scenarios where you have to run into surgery. One of those examples is in First Nations communities. There are a large number of births with hip dysplasia. And if we can detect them early, then the resultant activity can be very minor in terms of the intervention and enable that individual then to have proper gait and be able to walk properly. But if not, then that individual would have to likely come in for surgery, and the success rate is lower than if you can prevent it earlier. So we have an interesting opportunity around medical devices. We have a local company with artificial intelligence tools that we can use to enable First Nations communities to have that capacity delivered by themselves for their own communities to drive better health outcomes. The opportunity also is there for this Edmonton-based company to partner with another company that actually has remote ultrasound devices that could bring this whole area into fruition. But again, to what you asked before, Eva, what does this bring in terms of policy and registration and for protection of our individuals? We've got wonderful technologies that are going to change the way we're going to be able to do things, enable individuals to be stronger champions for their health. And how do we balance that with patient safety?
Excellent. Thanks very much, Reg.
Thank you.